Hello, students and teachers. Welcome to our Career Exploration Fair Health Sciences Careers panel. We are so excited that you are here. If you are attending this live, the chat will be up in a couple of minutes. I'm Lauren Kunze. I'm the Director of Program Strategy and Partnerships for Junior Achievement of Southern Colorado. And welcome to this panel. Please, when we get the chat up, put the name of your school into the chat. And also, if you have a question for one of our panelists, we are hoping to get a lot of our live Q&A questions answered during this panel. So if you have a question that has been a burning question, please put it in the chat and we will make sure that we get that answered for you. We are going to try to get as many of those answered as possible here live, and then we'll try to get some that aren't answered later on answered for you students. So we're going to introduce our panelists shortly, and then we're going to ask them a set of questions that Junior Achievement has put together, and then we're going to take your Q&A questions. So we're going to first get started, and I'm going to introduce our first panelist. So that first panelist is Bill Gold. Bill, can you introduce yourself and tell the students a little bit about yourself and your career?
Yes, my name is Bill Gold. I work at the Children's Hospital here in Denver. I work at the main campus, the Anschutz campus, and I am an RN. I have a bachelor's degree in nursing, so they refer to me as a BSN. And I have worked at Children's Hospital since '94, so I have been here for a very long time. I did leave for a little while and became a consultant and then returned to the hospital. I started out working on the floor in neurosurgery, neurotrauma rehabilitation, and I now work in nursing informatics, or what we refer to as the Analytics Resource Center. And my job is to do data analytics now. And that's quite a bit of a change in my future since I first started at the hospital.
Awesome. Thank you so much for sharing that with us, Bill. Our next panelist is Candy Eisenhower. Candy, can you introduce yourself and tell the students a little bit more about yourself and your career?
Hi, good morning, everyone. My name is Candy, and I am a pharmacist. My official title is Clinical Pharmacy Specialist in Primary Care, and I work for Kaiser Permanente. My job location is in a medical office, so a doctor's office, and a little bit of a less traditional role, although there are a lot of different opportunities outside of a pharmacy, like you may think of a Walgreens or a King Soopers pharmacy. And I can talk a little bit more about what I do. But the way that I got into this role, I took prerequisites in college and then was accepted into pharmacy school at the University of Houston College of Pharmacy. So I have a PharmD degree or a doctorate of pharmacy. And then after pharmacy school, I completed 2 years of residency. And this is where you get more training outside of pharmacy school. I've been with Kaiser since 2012, graduated pharmacy school in 2010. And so I've been in my current role for almost 9 years. And what I do is consult with the doctors and the nursing staff in the office and also talk with patients, mostly by phone. And what we try to do is come up with the best medication plan for that person that's seeing the doctor. So that could be the best medicine for them to be on. It could be maybe they've had side effects to medicines in the past and we need to pick something different for them. And also making sure that patients can pay for their medication, because medications are very expensive, and we want to make sure that those medications that we choose are affordable so that they can actually take them. So that's a little bit about what I do. I'm so happy to be here.
Awesome. Thanks for being here, Candy. And last but certainly not least, we have Lauren Graham. Lauren, can you tell the students about yourself and your career?
Hi, yes. So my name is Lauren Graham. Can you guys hear me? Okay. Sorry. My name is Lauren Graham, and I am a registered dietitian and also a certified diabetes educator. So I specialize in diabetes. A little bit about me and kind of how I ended up here. It's funny how you might end up in your career path. Actually, when I was 19, when I was in college, my dad actually passed away of a heart attack, and I was in a nutrition class at the time, and it just really spoke to me on how I could help prevent someone from losing their parent at a young age. So it just really spoke to me, and I kind of just ended up in that path of nutrition. So I work for Kaiser Permanente currently. I have done some different roles as a dietitian. I've worked in clinics and also more in community-based roles as well. But currently I am in clinic. I've worked for Kaiser for about 5 years. And on a daily basis, I am on the phone with patients, I'm doing video visits, teaching classes, and also working with our endocrinologist here with diabetes patients. So lots of different things that I'm involved in on a daily basis. To become a dietitian, so a registered dietitian, you have to complete a bachelor's degree in nutrition and dietetics, some kind of like field. And then you will go into an internship program that then allows you to be able to sit for the registration exam.
Great. Thanks so much for sharing that, Lauren. And what I love about this panel is that we have 3 very different careers represented in the panel. And some of you who have watched some of our career videos know that we also have interviewed a doctor. We've also interviewed a nurse. So we have quite a lot of careers that we have represented in our career exploration fair. So first question, and we've talked a little bit about the education required for some of your careers, but a lot of our students are interested to know some of the ways to fund the education required in your field. A lot of students are concerned about the cost of education, and knowing that health sciences careers sometimes can take a lot of schooling and a lot of education. What are some unique ways that you can fund careers in the health sciences field? What have you found personally? And we can start with Bill, and we'll kind of switch it up as we go along.
Yeah, for myself, I went to college originally right out of high school. Unfortunately, I did not do very well. And I went into the photography field and kind of bummed around for a while, making myself, trying to succeed in that. And then later on in life, I decided I wanted to become a nurse. I was already adult at the time, fully adult, and was married. And I basically gave up my career, sold everything, and started working what they call the weekend Baylor shift. I worked 16 hours on Saturday, 16 hours on Sunday, and paid for my own tuition and my own education. Was very difficult. A lot of loans were taken out. In nursing, though, in the nursing background, one of the most interesting I've heard is a lot of people look at the military, and the military is a wonderful way to find funding for healthcare. Also, with the nursing background, you become an officer very, very quickly. So it's very high level in there. Also, if you wanted to work like with Indian Health Services, very unique opportunity there. If you sign a contract to work for Indian Health Services for 2 years after graduation, they'll pay for your entire education. You do not have to be a Native American to do that. Anyone can do it. I have friends who have signed contracts with, so actually somebody who worked for me not too long ago, she signed a contract with a hospital in Sioux Falls, South Dakota, and she got her LPN, which is a 1-year degree. And after her 1-year degree, she started working immediately. I mean, it was guaranteed a job because they paid for her education fully. So she was guaranteed a position, and now she's going back to get her bachelor's degree in nursing and working as a nurse at the same time. So there's a lot of different ways to fund a nursing background because the demand for nurses is so high.
Wow, I didn't know that. That's so interesting. And we had a panel of folks in the military beforehand, and we had heard some of that as well. That's so interesting. Candy, do you have anything to add to what Bill has said?
Yeah, and I can share a little bit about my personal background because I supported myself right out of high school, and cost was a concern for me also. So I think the first thing that I would say is you can get a bachelor's degree and then go into pharmacy school, but in a lot of programs that's not necessary. So for me personally, I got my first 2 years of prerequisites and applied for pharmacy school right after that. And so instead of completing an additional 2 years of coursework to get a bachelor's degree, I chose to get my prerequisites and then go apply for pharmacy school right then. So if you think about that, that's sort of a way to eliminate a couple of years if you're very clear in your career path and you kind of know where you're headed. So that's a potential opportunity. Also, community college. I'm a very strong advocate for community college and saving money, especially for those first couple of years. And so I applied for every scholarship I could find through the school or outside of the school, any way that I could get a little bit of funding for my prerequisites or for undergrad. So I, saving a little bit of money going the community college route. I think if you put a lot of effort into your studies, those programs that are looking at you for pharmacy school, for example, are still going to value that education that you have. So it doesn't always have to be a big name school for you to be able to get into some of these graduate programs. And I worked through undergrad and through pharmacy school. So through pharmacy school, not quite as much because the course load is a little bit more difficult and challenging. And so you want to make sure you have plenty of time to study. But I was a pharmacy technician at Walgreens. So kind of in the career field, and was able to, it's a retail setting. So there was a lot of flexibility with what hours I could work. For my first 2 years of undergrad, I worked the 4 p.m. to midnight shift. So I did my coursework during the day and then went to work at night and put that money in my pocket. And that was more money that I could apply towards school. And I did also take out student loans for pharmacy school, since it is a pretty costly program. But every little bit that you can get through other means is, every little bit counts. So don't shy away from some jobs and don't shy away from scholarships, no matter how small they might be. Just apply for those.
Absolutely. What great points, Candy. And I actually worked through college as well. And hot tip for students, if you would like to work on your college campus, you can get a job with dining services often. And the other great thing about that job is that they feed you. So you can kind of double up there, save a little money. So thank you so much for those thoughts. Anything to add, Lauren?
Awesome. Yeah, thanks. Like Candy, I also worked through, I've working since I was 15, and I am kind of a frugal person. So I would work even at 15, but not spend my whole paycheck, because I knew that my goal was to be able to go to college and hopefully not end up with a bunch of student loans at the other end. So I always saved a little bit from every paycheck. And so I worked through all the way through grad school. I was definitely working, what you can. Sometimes your class load is a little bit, more, where you work less and you get in on the weekends, you get in the evenings, and where you can. Again, like Candy, I do encourage you to apply for those scholarships, even if they seem small. I was lucky enough to get, when I went to grad school, an in-state tuition scholarship, which was huge, which really saved me really big in the end. And yeah, I think that, just kind of keep your end game in goal, and you can get there.
Awesome. Thanks so much for adding to that, Lauren. Those are some really great tips that our students can think of to kind of chip away at that cost of higher education. So what are some best practices for preparing for a career in the health sciences industry? If you could do it again, is there anything that you would do differently? And let's start with Candy for this one.
All right. Yeah. So best practices. So I think for me and for the field of pharmacy, I know that something I would do differently is just explore what all of those opportunities might be. There are so many roles outside of the traditional pharmacist, like you may think of, dispensing the medication. So you bring a prescription to the pharmacy and you fill that prescription so that patient can have their medications. And so it wasn't until I was in pharmacy school that I discovered that all of these different opportunities exist. So you can do something where you are in the community and you're that first face that they see when that patient wants to pick up their medications and start to feel better. But there are tons of other ways that you can other different paths that you can take. So for myself, I chose a more clinical route, but even within being more clinical and working with doctors and patients in that way, there's so many different ways that you can take that. So I work in a primary care doctor's office, but you can work in a hospital, you can work in a doctor's office, but do something like a specialty, neurology or oncology. So if you have an interest in helping people with cancer or helping people with nerve diseases, the sky's really the limit in all those different areas. A pharmacist can really be part of that healthcare team, which is, something that healthcare is definitely embracing now, working as a team. You can do research. If you would prefer to work in a lab, maybe you aren't super interested in talking with patients directly, but you're interested in the field. You can do research. You can work for pharmaceutical sales. There's just so many different opportunities. So I think a best practice would be just explore what options are out there, and maybe don't close yourself off to a certain field because you have an idea of what that person does, and maybe you're just a little bit limited. So get on Google, look at different organizations that are in the healthcare field, and just discover what opportunities there might be there for you. You may do something non-traditional. And the other question, what was that? Oh, if I could do it differently. Yeah, I think that's pretty much it. Just making sure that I educated myself and had as much information going into it ahead of time. And then, some of those jobs you do before you get into the professional school, you could work through school and do something in a field maybe where you would want to end up.
Awesome. Thank you so much for sharing that, Candy. And Lauren or Bill, anything to add? Take yourself off mute.
I'll definitely add something to that. Sorry. I completely agree with Candy on that. Is that, with being a dietitian, there's so many different realms that we could work in, either in community settings. I used to work for the American Diabetes Association, and I've been a dietitian for camps for kids with diabetes. I actually thought originally that I really wanted to go into heart disease because of my dad, and quickly learned kind of the ins and outs of that, and actually really diabetes spoke to me. So I encourage you to volunteer if you don't have the ability to work within the system, to volunteer your time and to shadow people, because there's things you think you want to do, and sometimes when you start to get into it, you're like, maybe there was something else I wanted to do there. But don't let that stand in your way. Just kind of keep researching and keep looking for different opportunities. Another thing with a dietitian is that because you do have that internship program that we have to do, one thing I definitely say best practice for me, and one thing that I wouldn't have changed, is I ended up doing an internship combined master's program. Your internships are you're going to take up about 2 semesters of your time, and then just a little over an additional year, you could have a master's degree, which then puts you ahead of the other competition of that hiring job market. So just something to kind of think about.
Great point.
Sorry,
Anything to add, Bill?
My dog has decided he wants to go crazy in the background. I'm very sorry. Sorry. Like you guys were talking about the varying abilities. So many people think that a nurse is basically the person at the bedside who, cleans the patient. And if nursing is the farthest from that as it could be. And looking at nursing as a profession and thinking that this is what I want to do. This is, I'm going to be at the bedside for the rest of my life. I thought that at first. And when I went into nursing, I actually went in as an emergency medical technician. Was my first introduction into healthcare. And then I left for a while. And when I came back to healthcare, I came back as went back to nursing school. I got my CNA license, which a CNA is one of our entry-level positions. It's basically a certificate that you get. So it can be as little as a 3-month degree or a 3-month certificate. And then instead of taking the branch and becoming an LPN and an RN, I went ahead and went directly into my RN license and a bachelor's degree. But I also went to Arapahoe Community College for the first 2 semesters before I went to CU. And so, and I have friends who have gone to nursing school and then became lawyers, became doctors, became nurse practitioners. There's nurse practitioner alone. I think there's 25 different degrees for nurse practitioners right now. And as a nurse, I have never been without a job. And we can pretty much work anywhere we want. I have a niece who is a nurse, and she's a traveling nurse. And she literally travels all over the United States, taking a new contract every 6 months, and has even traveled to the Caribbean and had her all expenses paid to work in the Caribbean for 6 months. So you don't think of a nurse as somebody who just is at the bedside. We definitely are not that.
Wow, those are some great opportunities. So that kind of leads us into our next question. So what are some trends that you see in hiring in your industry? Bill, I know you're talking about nursing being a huge hiring industry right now. How can students best position themselves for a career in your field? What kind of inroads do you think that students can make?
I would say if you're looking at a career in healthcare, just in general, one of the other panelists said volunteering. Volunteering is probably one of the best things that you can do. Start off right away. Don't think that you need to have an you'd have to have a degree before you start in healthcare. Like I said, I started with a certificate is a CNA. A lot of kids that I know nowadays are getting their certificates as high school students. I think the minimum age, I don't know in Colorado, but I was just recently in South Dakota, and it's as young as 16. And they are very well-paying jobs. I mean, it's definitely not fast food. It's a very hard job, and you are caring for patients, but it's an excellent way to make a lot of fairly good income and to get experience in the field. So work as a CNA. One thing I will tell you is don't ever give up on it, because I have a lot of friends also who went and got their CNA and they're like, oh, this is it. This is all I'm going to do. And it's so sad. You see that level of education, that level of expertise, that level of skill, that level of caring, that they stay at that entry level and don't work their way up. So if you do that, make sure that you make a goal for yourself to get as far as you can. I stopped with a bachelor's degree. One of the reasons why is because I went into the IT department and started working in data analytics. By the way, guys, we have pharmacists that work in data analytics and dietitians that work in data analytics also. In my own division, I have 2 pharmacists and a dietitian that I work with on a regular basis. We all do analytics. We just do different branches of analytics. Mine is more clinical. There's a pharmacy analyst. There's also the dietitian is more of a clinical analyst. But yeah, when I went into nursing school, it didn't box me in. It opened the world for me.
Great, thank you. So the sky is the limit, and make a goal for yourself and make a plan for attaining that goal. We talk about that a lot in junior achievement programs, and certainly in this career field, there are a lot of opportunities. Anything to add to that, Candy?
Yeah, I think that I would say just, again, not boxing yourself in and not just being open to different paths within a career field, but also being open to different parts of the country. For example, I travel, I'm not originally from Colorado, but I came here for a job, and I was in a different place for residency, a different place for pharmacy school. And I know that's not for everyone, but just being open to thinking of those possibilities could potentially help. And again, just like Bill said, don't limit yourself with your education. So I didn't know that I would pursue residency. I'm not even sure I knew pharmacy residencies existed before I got into pharmacy school. It wasn't until my final year of pharmacy school before I decided, I could work at Walgreens. That was the path I was on as a technician. I thought I was going to be a pharmacist at Walgreens, and I decided to take my education a step further, and I don't regret that one bit. And just understanding sometimes life gets in the way, and you have to handle life, but it doesn't mean that you can't come back to it at some other point. Just don't give up on your dreams, and what seems like it's going to take forever to get there in the future really will be here before you know it. So I don't know, time moves faster, I think, the older that you get. So, just understand that really the only thing that limits you is you. And there's lots of people along the way that are happy to help you and want to give back and want to talk to young people about how to get where they want to go.
Oh, those are great points. Time does fly, doesn't it? So time flies. Don't be afraid of those big goals, and don't be afraid to sign up for something knowing that the time is just gonna fly by. Lauren, anything to add to that?
The only last quick thing I would add to that is that actually networking, which kind of sounds strange in the health career, but yes, networking is huge. I learned that a lot working for the American Diabetes Association. Just meeting people, it opens doorways. Also, become members of associations. So we have like the Academy of Nutrition and Dietetics, and going to those meetings as college students or as students, or shadowing or volunteering really helps you to meet people in the community, and they can help open your doorway as well.
I love that advice, particularly because I think it's applicable to about any career you can think of. Make sure that you're networking and meeting people because that can really open doors for you. Thanks for that comment. So one last question. I think we might have a question from the audience. So this is kind of a big one, so try to distill it down to a few brief comments. But how has the COVID-19 pandemic changed your industry? And this is a huge one for the health sciences career field. So we'll start with, let's start with Lauren, since you're already on camera.
So as you know, probably in the health sciences careers, we are considered those essential employees. So most of us have been still working through the entire kind of COVID pandemic when people were still staying at home. What that kind of looked like different for a lot of us is telehealth. So telehealth was always something that Kaiser had, but people really didn't take much advantage of it. And now it's really incredible how much we do via telephone visits or video visits, video platforms just like this to hold classes, to kind of keep people in that social distancing. So it's really interesting to see how it's changed our careers, and how, we are having to do things differently. So I get to still play with my fake food. I just get to do it over video instead of in person sometimes. As that too, we still have been in person as well. So it's just been fun to kind of watch things change.
That's so interesting. Candy, anything to add from the pharmacy perspective?
I'll echo what Lauren says. So for me personally, just doing a lot of what I do by phone. And I will say for the pharmacy profession in general, pharmacists can give immunizations. And so we've played a role in the COVID-19 vaccine distribution and administration, and also COVID testing. They called on pharmacists who have access to the public to be able to help with those efforts. So that's been super exciting, just to play a firsthand role in the pandemic and getting us through the pandemic.
Great, thanks for adding that. Bill, anything different for you this year? I'm sure quite a lot of things.
Because I work with the IT division of the hospital, I have not been in my office, I think twice in the last year and a half. And they are talking about us never returning to an office. So, however, I am still an RN, and the call was given out for RNs to return to the hospital to do vaccinations. And I personally gave over 700 vaccinations. So I was more than happy to return and help out where I could. I also volunteered to do bedside care again, and luckily never got to that point here in Colorado. But yeah, I mean, just because I'm not at the bedside anymore doesn't mean I'm not a nurse anymore. So yeah, things have changed a lot. Telehealth is huge. I will tell you that as soon as COVID hit, the IT division was put on the red alert, and we did more work faster than we have ever done before, and we still are. I mean, it's daily we get requests for research and data analytics. We, because we're such a large research facility, we are actually getting calls from other countries. We're involved in some research with Germany on adolescents pre and post lung x-rays. And we at Children's Hospital is also doing one of the national studies for the adolescent and child use of the vaccine. We're actually vaccinating children with, I think, both Pfizer and Moderna as part of the national study. So, and of course, data analytics has to be done on every single one of those studies. And that's where I come in is with the data analytics piece of it.
Wow, that's so interesting. I hadn't thought about a lot of health institutions also being research institutions and really kicking into high gear during this pandemic. And 700 vaccinations. Oh my gosh, Bill, you've been a busy man.
Yeah, it was pretty fun. It was very fun to get back there and the emotions that you see.
Well, we are just at about time, but we're going to try to squeeze in one student question. So we have a question from Ariel from Doherty High School. She wants to know, what are some of the negative or challenging aspects about medicine from a professional standpoint? So I'm going to pick on Candy because it can be answered a couple different ways. Medicine is a larger field, or maybe medicine itself. What do you think, Candy?
Yeah, so some of the challenging pieces, I think lots of jobs have their challenges. I think that, I guess for me, just wanting to make sure that everyone can work in a team format. And, I think that a lot of health profession training is now incorporating kind of that team aspect. So where each individual contributor can come together to come up with the right plan for a patient. So we need everybody. We need doctors, we need nurses, we need pharmacists, we need dietitians, because a person is, isn't just the medication that they take, and it's not just their vitals or just their disease that you're trying to treat. So I think there's been opportunity through my career, and I've seen huge changes from even just graduating from pharmacy school to where I'm at now in my career, just seeing different organizations embrace that team approach. So that was a challenge in the beginning that I've seen come very far in the almost decade that I've been practicing. And I think, just being able to have the time you need to dedicate to your patients. There's a lot of work that we all have to do in one day, and a lot of patients that we have to touch and to take care of, and just figuring out the best way to do that so we can get all of that patient's needs met. That's difficult, but it's doable.
Absolutely. Thank you so much for sharing that. Bill, Lauren, anything to add?
I would say one of the most difficult things in the nursing field especially is taking care of yourself.
Absolutely.
We pour a lot into what we do. When you're at a difficult patient and you're dealing with life and death situations on a regular basis, especially in the pediatric population, it can be very, very trying, and burnout can be very, very high. But once you find your niche, find your team, and find where you belong, then you'll do okay. But make sure you take care of yourself.
So take care of yourself, find a good team, find that support, and really make sure that you find your niche. Awesome. Anything to add, Lauren, before we close out?
Just one quick thing I would really encourage, obviously in the healthcare field, we're a service industry, is just kind of thinking of empathy. I think empathy for our patients is huge, and really understanding where they're coming from, what are their barriers, and why sometimes they aren't making those changes that we ask them to make. May not be that they're not listening. Really kind of diving down deep and really understanding them as an individual is really important. So just something I would encourage.
So that's such great advice, Lauren. And it's empathy being so important, especially when you're working with people and with humans, especially in that preventative care where, you may have some hurdles around that. Well, thank you all for your time. We so appreciate you. Thank you, teachers and students, for joining us today. If you have questions that you weren't able to ask during the chat, you can certainly send them to Junior Achievement staff, and we will try to get them answered for you. But thank you all for being here, and have a wonderful day.
Thank you, guys.